I was just looking at my YouTube videos the other day and I realized I do not have a single video about C-sections. How does the pregnancy nurse not have a single video about C-sections? Of course, we've talked about it in different videos, but today I want to help you prepare for a C-section. And before you think, Hilary, I am not having a C-section, I am here to tell you that 1/3 of births in the United States end up happening as a C-section. Now, is that too many? Probably. I'm hoping that we're working to decrease that rate, but the reality is that everyone should have some preparation for a C-section. I'm not talking that you need to know how to perform the procedure, just some basics. So today I want to talk about how all of you should be getting prepared for a C-section. I'll also have some extra tips for people who know that they're having a C-section that they can be using as well. The first one is to mentally prepare for a C-section. I think the reality of labor and birth is that there is a chance that you can have a C-section and you literally have no control over it. I know all of these people are saying that if you just moved more or, did spinning babies for your whole pregnancy or moved into different positions during labor, you can prevent a C-section. But I'm here to tell you that after 20 years in labor and delivery, where I've practiced all of these different things, there are some babies that we just cannot get to descend into the birth canal, or you could have issues during labor that you literally cannot prevent. And one of the weirdest, craziest things is that if you are stressing out trying to prevent a C-section, you could cause your blood pressure to go up, which could be a reason that you might need to end up having a C-section. So I'm just here to say that you need to be okay with the fact that it is not something that you can prevent. And there's a lot of things in parenting that is in the same fear. The reality is that you can't prevent everything from going wrong. What you can do is prepare and do the things to try and prevent it, but also be flexible if it were to happen. And I'm glad that you guys are at least watching this video because I bet a lot of people just scrolled on by so that you're getting some basic preparation. Now, in that same zone, I would totally recommend taking a birth class that talks about C-sections. There are a lot of birth classes out there that only talk about breathing or VBAC, but I think that every birth class should talk about a C-section because, again, 33% is not a low number. So taking a birth class that has a section taught by an expert on C-sections would be really smart. And as a side note, understanding that I am biased, I do not think that C-sections taught by a doula or just a childbirth educator who have not seen a lot of C-sections are extremely helpful. So that's something to keep in mind. But I did want to give you a few things that you can think about. And again, I would recommend a class so you can learn a little bit more. The first one is that the C-section room is very cold. We have to keep it in a certain temperature range to prevent bacteria from growing. Because again, the main thing that we want to prevent in a C-section is you getting an infection. And so there's certain temperature settings, certain actually humidity settings that we have to be within in order to safely do your C-section. So if you go back there and you find that it's cold, we can give you a warm blanket, and they can actually, in most hospitals, give you warm IV fluids, which can help you feel a little bit more comfortable. The crazy thing is that usually you're also nervous when you go back there. So you're, combating both of those things. A lot of people get a little bit shaky back there. So, it's normal to be nervous. All of that is very normal. And your nurse is there and your anesthesiologist is there to help you through it. And in fact, I just had a friend who had a C-section and she was kind of surprised by how amazing her anesthesiologist was. And I've got to tell you that anesthesiologists sort of get to pick a track. They can either be like a trauma anesthesia, which those are the people that like crazy things going on, or they can kind of pick a track where they do OB anesthesia. And those are the people who kind of like people more and they like talking to you and they like helping you through things rather than like just working with monitors and things like that. So I just want to put it out there that often the anesthesiologist is your buddy in the OR and is very, very helpful. The other thing, I just saw a TikTok about this. She was like, why is there so much counting going on? Just know that there is a lot of counting going on. We need to know that the things that are outside of you before the surgery also remain outside of you during and, well, sometimes we put things in, but they are outside of you after the surgery, aka we've left nothing in. And so you'll hear lots of counting. You'll hear different instrument names and we're counting those different things. So just important to know that that is something very normal that's happening. And you can ignore it because it's just for the staff that are counting the instruments. And then finally, your partner, most likely, unless you go under general anesthesia, can be in the room with you. Most often, they don't let them in the room until after they've done the spinal procedure, again, because we're trying to limit any bacteria that were in that area. But once we get you good and numb and lay you back, then we bring your partner into the room and they can hang out with you and baby after you have the baby. Again, there's more things that you're going to want to know for a C-section. I'll link that class down below. And if you're like, Hilary, I just want the C-section stuff, I actually actually have like a mini class that's just about C-sections that I'll link there as well. But I do recommend that everyone get a full-bodied birth class. I just have to put that out there. But the mini class is there for just such an occasion. You need to know that before you go in for a C-section, they're really worried about eating. Now, if it's an emergency C-section, they sort of ignore that. But if it's a planned C-section, there's going to be a certain amount of time that they don't want you to eat in advance. That's because if you were to throw up, we don't want food ending up in your lungs because lungs are super important. So you can eat pretty much whatever right up until the point where they tell you that you can stop. But I think it's important to know why they're asking so much about eating. And that is the reason why. And studies do show that. I know that you'll see people online who are like, oh, you should be able to eat the whole time you're in labor. That is very different than knowing you're going to have a C-section. It's important that you stop eating and things like that. As far as like what you'll do before a C-section with your body, I have seen some providers who ask you to shower with a specific kind of soap. And some hospitals do these wipes where they will wipe you all down, and it's kind of a sticky. I didn't like it before I got my appendix out. I got to put that out there. But there are sometimes things that you're doing for your whole body, and all of these things are meant to decrease the bacteria so that you're less likely to get an infection after your surgery. And let's talk about recovery, because your recovery is going to look a little bit different after you have a C-section. But one of the things that a lot of people don't know is that you still bleed. So many people think you're only bleeding from your vagina like when you have a period because you've had a vaginal delivery. But no matter how you end up having your baby, your uterus has a placenta-sized scab on it, and it is collapsing down on that to stop you from bleeding. But that is what is doing most of the bleeding, not anything that happened in the birth canal at delivery. So if you have a C-section, you still have that scab and you're still going to bleed after you have your baby. So you're still going to want the pads. I have a whole video on supplies that you'll need postpartum. I'm going to link it down below, and it gives you some of the specifics on that. If you end up having a C-section, I think it's important to look for higher waisted yoga pants. Depends. In that video, I show a brief type where it goes really high, and that's important because your C-section scar, you can't even see it on this video. It's going to be, they call it a bikini line. It's right kind of where your body naturally folds right there. It's real low, but some people have underwear that hits right there, and you are not going to want that right on your incision. So looking for high-waisted things, or just wearing a gown or house dress or robe that you have just like bypasses anything needing to be on that area anyway. I had a gal come on my podcast, and she had I think 4 C-sections, and she said that she just loves the house gown after so that she doesn't have to deal with pants in that area, which totally makes sense. Breastfeeding can be a little bit more difficult after you have a C-section. Again, I think it's important to look for lactation help no matter how you're having your baby, and to have an appointment scheduled for when you go out of the hospital. So look around for someone that can help you. In the online prenatal class for couples, we actually have a whole breastfeeding video. I'll link it down below, and it's taught by a lactation expert, the Breastfeeding Mama, and she actually does virtual consults that you can use as well if you can't find somebody in your area. I will link her down below as well. And finally, this one, it just doesn't make any sense because you're hurting. I mean, that first time that we get you up, people are like, you're seriously standing me up, even though they just like cut me in half like a magician. The more you move, the better you're going to feel. And it is not going to feel that way the first couple times that you get up to the restroom. Use the help. You know, I am there to help you get up. Often your partner's there to help you get up and make your way to the restroom. But the more you can move about the room, and again, move about the unit if that is an option, the better you are going to feel. When you have a C-section, there's kind of these trapped gases inside your body, and the way that you get them to absorb and disappear is through movement. So make sure that you are moving a lot after you have your baby. I know that there are so many people out there who are saying, oh, after you have a baby, you should stay in bed all the time. And our natural inclination is to stay in bed all the time, especially after surgery. But movement is going to be the key to feeling better. So make sure that you're doing it, and listen to your nurses so that you're both not overdoing it, but also not underdoing it. Now, if you are having a planned C-section, I cannot recommend anymore making sure that you get a class that has C-section preparation within it. The other thing would be to see if your hospital has any information for C-section moms. We had a little pamphlet to kind of help people know what to expect, because it's very regimented on when people arrive, what we're going to do before a C-section. It's much more regimented than natural labor, right? That flexes and flows as to how people are going, but a C-section is very scheduled. So a lot of times hospitals will have a little pamphlet that you can read ahead of time. Now, most first-time moms are not not having a planned C-section. They end up having the call made for a C-section either urgently or sometimes emergently during their labor. And how do you prepare for that? Again, I would take a birth class that goes through the C-section. The online prenatal class for couples, that video is under 20 minutes. So you're just learning the basics. And so many people say that they felt so much better because they had taken that lesson. A lot of people are going to think, oh, I can skip the C-section lesson because I'm not going to have a C-section. But again, hopefully in this video, you're realizing that not everybody knows that they're going to have a C-section. So it's important that we get that information in advance from an expert. And the other thing with those emergent or necessary C-sections is making sure that you have the ability to talk with your provider about if this is really necessary. Sometimes providers are going to come in the room and say, you know, it seems like labor has stalled and I'm going to recommend maybe a C-section at this point in time. And some people are going to be, hallelujah, get this baby out. I want to have a C-section right now. And some people are going to want to ask questions, ask if they can wait, ask if they can continue to use movement to promote the baby descending into the birth canal during their labor. So make sure that you're also getting a class, which the online prenatal class for couples does, that helps you have those communication skills to talk with your healthcare team to make the best choice for you, because the choice is not going to be clear cut for everyone. Again, there's those people that are like, thank goodness, let's get this baby out. I'm done. Let's have a C-section. And there's those people who are like, no, I don't want to have a C-section. And so everybody has to make the choice for you. Now, there are obviously times that it is cut and dry. Baby's heart rate is down for a long period of time. So we need to have a C-section. But those are very different than some of the gray area that we traverse in labor and delivery. Honestly, making choices is one of the skill sets that most people are lacking before they come into labor and delivery. And I actually have a whole video on making choices in labor and delivery. I'm going to link that one up above. Thanks for joining us here on The Pregnancy Nurse, where we finally have a C-section preparation video and where we get you prepared, not scared, for your upcoming hospital birth.